Hi, my name is Andrew. Today I'm going to be showing you how to administer medications and the IVAR, which is the IV medication administration route. I'll be also showing you how to use, how to pass medications with the BCMA, which is our barcode medication administration. The first thing that you want to do is locate the eMAR IVAR tab. Once you click on that, you want to expand your eMAR, which is this button here. You'll notice the times of medications that you have to give. Currently, the computer says that it is 16:12, so I'm going to go to that time frame by clicking the next button. And there are my 1600 medications. To administer the medications at the same time, you're going to click on the icon C where it says 1600 and select all. Press OK. And it's waiting to scan. It's actually asking to scan the patient's ID band. This is when you take your barcode scanner and you're going to scan the patient account number. On the ID band, you're going to find the MedReg account number and the patient account. Make sure it's the patient account. So I'm going to go ahead and scan that. And at the bottom it says enter date and time procedure was performed. So it's the now, which is now. So I'm going to hit the enter button. And you'll notice on the MedRec that you have medications up here: insulin, aspirin, Zithromax, and Aldactone. I actually do not want to give the insulin that popped up on there, so I'm going to click on that and hit the remove button. Okay, so now I want to give the aspirin, Zithromax, and Aldactone. So after I've pulled out my medications from the Pyxis, behind the medications you'll have the barcode. You want to go ahead and scan those, as it says on the bottom, scan barcode or select event to administer. So I'm going to locate my barcodes from those, and I'm going to go ahead and scan. Scan the aspirin first. You'll notice that it turned gray up here, which is an indication it's okay to pass. And actually on the right it says okay to administer. So we'll go ahead and do that. The next one we're going to scan is Zithromax. It's a 500 milligram dose. So I'm going to scan that medication. And you'll notice that a little warning came up. It says under. The dose is 500 milligrams, and I scanned a tablet that's 250. So I owe the patient another 250 tablet. So I'm going to go ahead and scan another one. And it gave me 2 times 250, which is the 500 milligrams. It's the first dose that we're giving, so whenever we do a first dose of the medication, we educate the patient and we document, yes, that we did do the education. Press OK. And that one highlighted into a different color, and on the right hand side it says OK to administer. The last medication we're going to give is Aldactone. We're going to go ahead and scan that one. And it's a 25 milligram dose. It's saying to give 1 tablet. It says it's the first dose, so we're going to go ahead and do education on the patient. Hit yes. Press OK. And we are OK to administer. We have our grayish colored here, and we have the OK to administer buttons here. And we're going to administer the medication and accept. Once you accept, that means it's been documented to the system, and it will show the times that the medication was given, and it's gone from our MedRec. The next medication that I want to show you how to administer, or what to administer, will be, let's take a look here. We're going to go ahead and administer the Protonix 40 milligram suspension by mouth daily. This one is scheduled at 15:30, so we're going to click on that there and press OK. Now it says waiting for patient identification to be scanned, so I'm going to scan the patient's ID. It says when am I going to administer this medication? It's going to be now. And it's asking me to scan the barcode of the event. So I'm going to scan the Protonix, but I'm going to do something a little bit different. I'm going to scan the wrong route. So you'll notice that it says 40 milligrams suspension, and I'm going to scan by accident the 40 milligrams IV to show you what it does. Okay, so it's going to give me a whole bunch of warnings. It says that this is an injection dose. So I'll look back up here. It says suspension. I notice that I pulled out the injection. So at this time, I'm going to click on back. I will go back to the Pyxis and obtain the correct route of the medication. Okay. We're going to go ahead and try to administer another medication. The next medication that I want to give will be a morphine 4 milligrams IV push stat. Okay, it says waiting for patient identification to be scanned, so I'm going to scan the patient's ID. It's asking when do I want to give that drug. I'm going to say now. Now it says that current procedure is not being resulted at the normal time. The doctor wrote the order to give the drug at 15:15, and it's actually 16:17. So this was the first time the drug was available, so I'm going to go ahead and give the drug now. So I'll click this button here, and it's reminding me that I'm giving the morphine 4 milligrams. Now it's asking to scan the barcode or select the event to administer. So I'm going to assume that I don't have a barcode. I'm going to overwrite this. So what I'm going to do is I'm going to click on the drug here and press OK. And it's asking me why am I manually overwriting this drug. And I'm going to put it's a stat event. It's asking if the patient is in pain. I'm going to say yes. And we checked it by its numeric scale. We'll continue with the pain level. In this section here, it's asking where is the pain, how is the pain, and the duration, and so forth. So based on your assessments, you'll fill this out appropriately. And we're going to administer that drug. Okay, so I showed you how to administer medications together. I showed you how a drug is a multiple dose, like the Zithromax is required 500, you scan the two 250s. I showed you what happened if you scan the wrong medication, and I'm going to show you what happens if you underdose a drug. Our next drug that we're going to administer, let's see, it's going to be the artificial tears. Artificial tears we have scheduled at 15:45, so we'll go ahead and click on that. I'll press OK. It says waiting for the patient ID to be scanned. Okay. The next is asking the date and time. We'll say we're doing it now. And I'm going to go ahead and get my drug of those artificial tears. And at the bottom it says scan the barcode, so I'm going to go ahead and do that. And it's saying that I'm going to give 1 drop of those tears of the solution. So I'm going to press complete. I'm going to document where I'm giving those. Press OK and administer. Accept. So that's how you would give something with the an ear drop or an eye drop solution rather. Now to underdose the medication that I told you that I was going to explain, we're going to do a nitro patch for the patient. Okay, so I found the nitro patch that we're going to give to the patient. I clicked on OK. To scan the patient ID, we're going to go ahead and do that. We're going to give it now. Let's try that one more time. Alright, so it's saying that we were going to give a nitro patch of 0.2 milligram. I'm going to go ahead and scan a nitro patch, but I'm going to scan a different dose. I'm going to scan the 0.3 milligram. I want to show you what happens. I'm going to scan that medication. and it automatically tells me that I need to verify that dose. The doctor ordered a 0.2 and I scanned a 0.3. Immediately I'm going to click back. I'm going to get the correct dose, which I just obtained. It's the 0.2. I'm going to scan that one instead. And now it went through and asked me where did I apply that patch. I'm going to say I gave it to the left chest. Click the OK button. And we're going to press OK one more time. I have the shaded color here. On the right hand side it says OK to administer. We're going to click the Administer All button and accept. And that's how you administer medications through the barcode medication administration. Next, what I want to show you is how to administer medications through the IV route. Okay. You're going to locate your eMAR IVAR. This time you're going to find where it says IV administration and expand. Today I have two IV medications. One is a sodium chloride. The predicted action is asking me to hang this, so we're going to go ahead and hang that. The second IV says that I have the sodium chloride, the half NS at 50 cc's an hour. The doctor wants us to take that down. So let's go ahead and do that one first. So what I'm going to do is I'm going to click on that item and click on OK. It's asking me when do I want to do this or when was it done. I'm doing it now, so I'm going to press OK. Now pharmacy has not reviewed this order yet because the doctor just put it in, but we're going to go ahead and do that now because the doctor wants that now. And the event says to take down, so we're going to go ahead and click on that and press OK. And it's just reminding me how much fluid I have remaining. That's fine. I'm going to press OK. And it's reminding me one more time what I have going on. Press OK. And administer. So what I'm doing is I'm administering the takedown and accept. And you'll notice that on my IVAR that IV fluid should disappear, and it did. The next I want to do is show you how to check an IV, or how to hang an IV rather, and then I'll show you how to check. So this predicted action says to hang, so we're going to go ahead and hang that IV that the doctor wants. We're going to click on that IV, press OK. It says when are we doing this? We're doing it now, so I'm going to press enter or OK. Now pharmacy hasn't reviewed this yet. We're going to override for now because we know that's what the doctor wanted. The prediction action says to hang, so I'm going to click here and then press OK. It's reminding me exactly what the doctor wants. Press OK. It's asking me when the last tubing was changed. Since this is a new IV fluid, I just did it now, so I'm going to put T for today. Actually, T doesn't work. I apologize. So we're going to do N for now. We're going to click OK. And administer all. Accept. So now that IV is hanging, and you'll see that the prediction action is to check. And now that we have 999 milliliters left. If we wait some time and hit the refresh button, you'll notice that it's starting to count down. This 999 will turn into a 998 and so forth. So we're going to go ahead and do a check. Hypothetically, let's say that there was only 900 cc's in the bag left. So we're going to click the check button. We're going to click on the drug that we're checking. It's asking me when do I want to check. We're going to say now, so we'll press OK or hit enter. It says pharmacy did not review this order. That's fine. We understand that. We're just doing a check. The prediction action is checked, so that's okay. We're going to click there. It reminds you what we're checking. We're fine with the check. It looks good. Press OK. OK one more time. And administer. If you want to edit, you can edit that one more time. So we're going to click edit. Click on the check. Make sure everything is fine. If there was 900 cc's in the bag, you can change that now. We're going to leave it the way it is because we just changed it. Press OK. And administer all. What we're administering is that we did the check. And that is how you administer your IV medications. You discontinue IV medications and do a check to the IV medications.